Could one or all of you address this idea that, and all of you sort of alluded to it in one way or another, and that is that a vaccination plan is not a herd health management plan. And so if sometimes it seems as though a herd health management plan gets sort of dissolved down into just a vaccination sequence and everything else is fine. Could any or one of you like to address that idea?
I'll give a little feedback here, Barry, and then I'll let Dr. Whitaker close out, because dealing in the dairy industry with closed herds, he might have a little different perspective. But what I think is really important to understand is vaccination is the process, and that's not your plan. So what people miss a lot of times is just the act of giving the vaccine is step one of many. We're asking a product to be manufactured correctly by a manufacturer like myself, handled properly through a chain to get to the producer, and then that producer handle it properly, mix it appropriately, get it into the right system to inject in the right place. And then what happens next is most important is immunization, the process of the body handling that vaccine and doing something with it. Same could be said for our overall health management plan. We shouldn't just be looking at one tool of it, and that one tool could be vaccine, that one tool could be management, that one tool could be the practices that we take into our production system. So I think it's a great point to just bring out that in any production system, we need a plan, and we need to start with what our goal is in the end, include our veterinarian, involve our veterinarian to help us make decisions on that health plan as it pertains to our whole system. So I think there's a lot of moving parts there, and I think you're right. What we hear, and Dr. Whitaker kind of alluded to that when he started his conversation, that what's the most common question? And I used to hear this when I was in practice, year in, year out, from the same producers. Hey, doc, what vaccine are we going to give this year? Or what's in the blue box, or what's in the yellow box, or what's in the red box, right? They just give me some 50 doses of the red box, and they have no idea of what the plan is and how we're going to move forward with that. And I think that's really important consideration for producers out there to think about.
Yeah, I mean, I agree. I liked what you said. There's giving a shot, giving a vaccine, and there's immunization. Immunization means you're actually stimulating the immune system. I mean, if you're giving a calf a respiratory vaccine and he's already got pneumonia and he's skinny and he's wet, you're not going to do any good there, and the chances of him being a poor doer and continuing to get pneumonia are high. I think about in the dairy industry, there's all sorts of different treatments for mastitis. Well, you don't want to be treating mastitis, right? The better thing is to keep that cow healthy, to keep her clean, so that way you're not dealing with those problems. Out here in Nevada, where most of our producers are cow-calf operators, they don't see a lot of respiratory problems in their calves when they're out with their mothers on the range. That's more of a problem when they're brought into the feedlot. So if they're healthy coming in and we give them a good vaccine before they're stressed, before they go into the feedlot, then they have a better chance of not developing pneumonia and getting sick when they're in the feedlot. But if they don't look good and they're in poor condition and their immune system is weak when we give the vaccine, well, it ain't going to do very much once they get into the feedlot. And I think that's the difference between a vaccination program and a herd health program. The vaccination program is part of the herd health program, but it's just one part of it.
Great. The other thing sort of that always seems to come to mind when we're talking about these things is the significance of subclinical cases. Just what, in your opinion, what is the significance of subclinical cases, for instance, in respiratory, undetected respiratory diseases? How significant can that be to a producer? And why should they? I mean, why should it be important to them?
Well, I think those subclinical cases, you're walking that fine line of, everything it's easy to make changes when things are going wrong. If you can't look out and see any real problems, then it's hard to want to make changes. And that's when people have a hard time wanting to do things different when everything seems fine. Where, if they're subclinical, it's easy to look out and see that calf with its ears hanging down, its head down, staying away from the herd and coughing. Oh, let's get that one in and treat him. But if the whole herd is just a low level, not doing great, they all look the same. So it's hard to detect those and fix those problems when it's not glaringly obvious to us. So I think honestly, it's probably, again, I go back to the dairy industry, a lot of times your subclinical mastitis is a bigger problem than clinical mastitis cows, because those clinical mastitis cows are removed from the milking herd. They're being treated, where those subclinical ones are causing all sorts of other problems that you're not even detecting, but you can't tell because they're subclinical. And that's what I think the biggest problem is with it.
I'd just add, Barry, when it goes to reproductive disease, not reproductive disease, respiratory disease, that all the pathogens that Dr. Whitaker brought up in his talk were good, a description of what's out there. And whether it's a bacterial pathogen that's in the upper airways, or if it's a virus circulating in the herd, those are everywhere. And if we think about how cattle move today, where we move cattle from California to Nebraska, from Florida to Kansas, and from Virginia to Nevada, right? We move cattle all over the country. We move the pathogens and what those pathogens could do everywhere in every place. And I make arguments a lot of times that I could probably go to just about any backgrounding feeder yard or whatever in the country and find all of those major pathogens. And so they're just there waiting for their opportunity to have a chance to infect an animal and cause disease. What we should be thinking about as a goal is how, one, do we keep the percentage of those pathogens down? Two, how well do we immunize calves at different points in their life to maybe better protect them? And then three, understand that those pathogens are there all the time, and we don't know when the opportunity is going to arise for them to leak down or get in, if you will, and begin to cause disease in our herds. So I think the respiratory disease is, and maybe that's part of the reason why in my practice career, nearly 30 years, that the percentage of deaths due to BRD are the same, right? Because those pathogens are still there. We have to better understand how we manage that animal and vaccinate appropriately at the right time to get the best immunization as possible.
I'll just sort of, we'll do this again. Each one of you can give me an answer. And that answer, or that the question is what is your, I don't know, maybe the term isn't pet peeve, but what is the biggest thing that aggravates you that you wish you could get producers to do or to pay attention to, that would make their lives easier in the long run? What is that one thing that you would like to see them pay more attention to in their individual operations, if there is such a thing? So
that's tough. I think the biggest thing is understanding that preventing a disease is so much more effective and better than treating a disease. We always, as vets, we get that call like, well, I've treated this with this, I've done Draxxin, I've done Nuflor, I've done Zactrin. None of this stuff works. And the problem is it's not working because it's past the point of being able to work. When the bacteria or a virus or anything attacks a body, it damages the tissue. So all vaccine, or not vaccines, but therapeutics, antibiotics are doing are trying to help the body remove that from circulation, from being inside the body. Well, if it's been there for long enough and it's already destroyed all the tissue, even if you get rid of the virus, that animal's not going to do good. So if those lungs are totally shot, and we see these on necropsies all the time. I mean, they're just fibrotic and gray, and they don't inflate. No amount of antibiotics or medication you can ever give anything is going to help that animal. So being more proactive than reactive is probably the biggest thing. And I get it. It's hard, especially when we have weather like we do now. I mean, this isn't normal, quite, at least in my part of the country for Nevada, to be this wet. But just to make sure that you're ahead of the 8 ball, and then not expect a miracle to give, you can't just give a cow a shot and expect her to get better if everything's gone wrong for the 3 months leading up to that.
Yeah, I agree with that totally, Dr. Whitaker. What we see many times, or what I saw many times in practice, is they want some sort of shot, whether it's a therapy or a vaccine, after the fact. And we need a better plan. One other thing that I would maybe add to Dr. Whitaker's discussion is, when I look at overall viral disease in livestock and preventing viral infections, I think, what is your goal, right? So I'll give an example. We talked about modified live and killed vaccines, and we talked about how killed vaccines are much safer. There's some risk, but there's also some good things. But what we do know is, if you use a modified live vaccine prior to exposure to the bull, prior to breeding, you're going to get a longer acting immunization and protection for that entire reproductive cycle. So the question I'm asked many times to producers is, what's your goal? Is your goal to protect the existing animal? Is your goal to protect the next calf or calf crop? Or is your goal to protect the calf that's just about to be born? Visiting with your veterinarian, understanding what those are, will help you build a better program. One of my pet peeves is they just want a shot of something because they read in a journal that they ought to be vaccinating for all this stuff, and they don't really have an understanding or goal of why they want to do it. And I think that's very important for us. Is your goal the unborn fetus? Is your goal just the cow? Is your goal the calf that's on the ground today? And I would argue in many cases, it's probably the next generation is your goal today, because you can't really impact something that after the fact. So thinking ahead, making a plan, making your health management plan, I think, are keys to success.
Yeah, that's a tough question, because my pet peeves are probably the most expensive things on an operation, which is body conditioning cows and then mineral programs. And I can't call it a pet peeve. It's more of a frustration that I share with them, because I think, especially body condition, if your animals are at an adequate nutrition plane, so many of these diseases in every aspect of the production cycle can be minimized. But again, I can't call it a pet peeve because the margins in the cattle industry aren't spectacular. So
It's a wish list more than a peeve.
yes, exactly. Yep, I think that's a much better way to put it.
Yeah.
Barry, I'd like to make a quick comment on that, because
Sure.
I think she's spot on. One of the things that people don't realize is, they tell me, when I ask a group of producers what's their number one cost in production, and most of the time they will tell me feed or labor. But if you look at the data and you do research, don't get me wrong, nutrition's one of the most important aspects, but it's not the most expensive. The most expensive is replacement cow cost. So if you aren't doing her pet peeve, and you aren't doing the right things for mineral and nutrition and development of those animals, your replacement cost, or the cow replacement cost, is going to go up, which, if with margins the way they are, she's exactly right. We can't afford for that cost to go up. So I applaud you, Dr. Hummel, because that's something that's near and dear. You hit a nerve with me, because I think that's near and dear to my heart as well, because we need to understand, or our producers need to understand, without the right steps, the most expensive portion of their business is going to be compromised.
Yeah. Most of the attention is always in input costs. rather than
Okay.
what you're addressing in outcomes. So absolutely. Absolutely. So I have this question that's been posed. How would you suggest that producer continue their education in the livestock industry from year to year so that they can stay on top of these new vaccination drugs and sequences and systems that seem to roll around every so often? How would you suggest that they stay on top of their education?
I would just say ask us. Like all my dairies, I'm at my dairies every 2 weeks or every week. Where my beef guys, I see them one time in the fall. If we test their bulls, I'll test their bulls. I'll vaccinate their calves, and then I show up the next year, and they have all their vaccines. And say, what should I do with all this? It's like, well, maybe that's not the best way to do it, but ask us. That's what we're here for. We're constantly going to continuing education so that we can share that information with other people. We're constantly getting talked to by vaccine representatives and other industry professionals, and they show us all the latest and greatest technology. The other thing I would say is don't get too overwhelmed thinking that you're missing something. I think we're always looking for the latest and greatest thing. Things aren't changing that fast. They're not developing new vaccines every 6 months. It hasn't changed that much from last year or the year before. Every once in a while, there are some new products and it can change some things. But the biggest thing is just ask us, maybe give us a call, or if you want to come into the clinic or do a lot of driving, say, hey, can you call me sometime and I can ask you some questions about some vaccines. That's the biggest thing, is just ask those questions before, we show up and we start checking cows, because by then it's too late. But it's just a good idea to ask.
Some of the new drug rules require an intimate, well, maybe intimate's not the right word, a really working relationship with your veterinarian.
Yeah. And that's the point. That's what we're here for. That's why we go to continuing education, and we get all this information from the state and from the federal government and from industry and everything. And that's part of our job, is not just to go out and vaccinate calves and test bulls and preg check cows, but to talk to you and educate you a little bit on what is going on as far as the animal health side of things is going.
I think visiting with your veterinarian, building a plan is what's really important. And I know some veterinarians out there today that are doing sort of annual reviews for customers, right? They'll sit down once a year and review what they've done, and based on what those experiences are, help that individual producer. To me, that's like sitting down with your financial planner, right? If I have 10% morbidity in a herd of 500 calves, that's a huge financial burden that maybe I could have prevented if I would have spent an hour with my veterinarian at the beginning of the year looking at my plan and developing what that might look for me the next year. And then part of that same plan is, I feel like that there are 3 or 4 things that really could create value for a beef producer from a data standpoint that he could collect every year and give him an understanding of how he's doing. And those are, how many cows did I put in with the bull this year? How many calves did I have barn? How many calves did I turn out to pasture? And how many calves did I sell, wean, or sell, or what, depending on what my situation is. Everybody can count. And if we do those simple factors, and I like to count how many calves are born. Everybody carries what's the NCBA has the little red book, right? The little red book where you put your cow number in it, when the calf was born, and all those dates. If you have any of that information plus the other, you can build a pretty good case for reviewing your successes or failures every year consistently, and take that information and do something with it. And that has nothing to do with health, right? That's just a good management practice for you to develop your plan around.
I will say this, that the guys that I work with that I would consider to have the best herds or seem to do a good job, they all have records. You know, they know exactly how many cows were pregnant last year, how many calves they had this year, how many were weaned, how many got sick. They all have records of that stuff. The ones that seem to always be struggling, it's hard to fix a problem when you come to the vet and you say, hey, you know, something's going on with my herd. Well, okay, what's going on? Well, I don't think I had as many calves as I did last year. Well, how many did you have last year? I don't know. How many do you have this year? I don't know. You know, and it's hard to fix a problem if you can't quantify the problem and say, okay, this is where we're lacking, this is where things are missing. So that would be a really good tip, and I like that.
Good. A related question. Should we strive for a 98% calf crop?
Oh, of course.
Always strive for it.
I had a producer that was 97 last year, and I think about 98 this year. And like I said, you know, he keeps records, and I don't think his operation's any different than anybody else's. You know, he's much like a lot of the producers here in northern Nevada. They run on outside ground. His cows aren't close very often, but you know, he keeps very good records and does a good job, and he gets a lot of calves every year, and he weans them, and they're nice calves. So yeah, it's something you should strive for, but it's hard.
I'd make one argument to that if I had 98% and 40% of them calf in the last 21 days of my breeding season, that's worse than having 80% calf in the first 21 days, right? So timing, and that's again with the records we talked about just a minute ago. If I know when they're having their calf, and because every day in a production system for a cow-calf operation, from the time of birth to the time of weaning, is worth about 2 pounds. So if calves have 60-day head start on other calves, they weigh 120 pounds more. And I don't know about anybody else on this call, but last I checked, we got paid on pounds. And it's worth it to think about those things. It's worth it on looking at how we immunize a calf to get more pounds. Can we have a calf born earlier to have more days on feed? Can we have a calf stay healthier because of the nutritional plan that his mother has? All those things add up to pounds in the end.
What you're basically saying in one way or another is that a calving window is part of a herd health management plan. It's not just a product of, I mean, if you've got a calving window that's, you know, 6 months out there, there's some management issues that are going to be need to be addressed other than just the economics. There's some health issues that are going on there. I have a question here that says, then what is an acceptable percent of a calf crop? If 98%, if we should strive for it, but you know, be realistic, then what is a realistic percentage of calf crop?
You kind of need to define calf crop. Are we talking calves that hit the ground versus weaning rates? Because like ideally you have a 95% preg rate, then maybe a 93% calving rate. And I believe the national average weaning rate is high 80s. So what's a calf crop? You got to define that period.
Right. And you're absolutely right. I mean, what counts is how many of them you load on the truck at the end of the year. And that's, you know, if you have a 98% conception rate, but you have a 50% delivery rate, then you've got a little bit of an issue there too. So yes, definitions matter. I have another question here that says, it kind of changes, gets us off in another direction. It says, should producers check their cows for what they do not have in their antibody system?
I say no. Simple is better. If you don't have a disease, a bacterial pathogen or pathogen, viral pathogen, whatever that's you're at risk for, why test for that? With the exception of, I think Dr. Whitaker did bring that up, and I spoke just briefly about BVD. If we have persistent infection or carrier animals exist with BVD more so than probably any other virus or bacteria. So that particular disease, even if you feel like that you don't have it, it may be a disease that's worth managing for surveillance, if you will, testing for. And the dairy industry has done a good job of that because they had higher incidence. There's a lot of dairies that test every calf born for BVD. In the beef industry, the seed stock producers typically do that at a fairly decent rate, but producers as a whole, based on producer size and implications of that, that's a pretty low percentage. So there are some that yes, but don't go looking for my point about the answer of no directly is don't go looking for a zebra when you have cows in your herd.
Yeah, I agree.
The only circumstance that I find myself answering that question or maybe testing for diseases that I don't necessarily think are there are abortion screens. Because I often don't find an answer in an abortion screen, but I want to make sure it's not foothills. I want to make sure it's not BVD. I want to make sure it's not Neospora. I want to make sure they don't have a problem with preventable diseases. But outside of that specific scenario, I would say no. And yeah, I'd just say no.
Cool. Well, folks, it's time to wrap it up. Those out there in viewer land, we've got to let these folks go and get back to their real jobs.